Iron deficiency anemia versus thalassemia. The Mentzer Index. What is a Mentzer Index? The Mentzer Index is a calculation used to help differentiate between iron deficiency anemia and beta-thalassemia trait. It is calculated by dividing the mean corpuscular volume, MCV, by the red blood cell count. A value less than 13 suggests a higher probability of beta-thalassemia trait, while a value greater than 13 suggests iron deficiency anemia. Here's how to calculate the Mentzer Index. Obtain the MCV. This is a value reported in a complete blood count, CBC, test. Obtain the RBC count. This is also reported in the CBC test. Divide the MCV by the RBC count. It is calculated by dividing the MCV, in femtoliters, by the red blood cell count, in millions per microliter. As in the formula, Mentzer Index equals MCV divided by RBC count. Interpretation of the result. If the result is less than 13, it is more likely to indicate beta-thalassemia trait. If the result is greater than 13, it is more likely to indicate iron deficiency anemia. Why Mentzer Index low in thalassemia? In thalassemia, the body produces fewer functional globin chains, leading to smaller, more fragile red blood cells, with lower MCV. The overall number of red blood cells may not be as significantly reduced. Reduced globin chain synthesis results in microcytic red blood cells, with a normal or near-normal RBC count. This leads to a low Mentzer Index. MCV to RBC ratio leads to count less than 13. Why Mentzer Index high in iron deficiency anemia? In iron deficiency anemia, the bone marrow struggles to produce enough red blood cells due to insufficient iron. This leads to both a lower number of RBC and smaller RBC. MCV measures the average volume or size of red blood cells. In iron deficiency anemia, MCV is typically low because the red blood cells are smaller than normal, microcytic. Mentzer Index. The Mentzer Index is calculated by dividing the MCV by the RBC count. In iron deficiency anemia, the RBC count is low. The MCV is also low, microcytic. Because both the numerator, MCV, and denominator, RBC count, are reduced, the resulting ratio, Mentzer Index, is more than 13, indicating iron deficiency anemia. Despite the benefits, there are some limitations of Mentzer Index. The Mentzer Index is a screening tool and not a definitive diagnostic test. The Mentzer Index can be helpful in differentiating these conditions, particularly in cases of microcytic anemia, low MCV. It is most useful in differentiating iron deficiency anemia from beta-thalassemia trait and not other forms of anemia. Further testing, such as hemoglobin electrophoresis and iron studies, is usually needed for a definitive diagnosis.